Have you had a red, painful, and swollen eyelid? It could be a sty, allergy, or a bug bite, but occasionally it may be a skin and soft tissue infection of the eyelid called preseptal cellulitis or periorbital cellulitis. Preseptal cellulitis refers to the condition's anatomical location, which is important because another condition, orbital cellulitis, looks similar and could be life-threatening.
This is the empty eye socket.
Looking at a cross-section of our eye socket, it looks like an ice cream cone with two eyelids covering the ice cream. And inside our eyelid, there is a thin membrane called orbital septum. It separates this external portion from the rest of the fat, muscle, and soft tissue inside this ice cream cone. The orbital septum is an important defensive barrier and pretty much the only barrier that prevents any spread of infections from the eyelid into the ice cream cone.
This video is for educational purposes
Preseptal
only.
cellulitis can happen at any age, but it is more common in children. This might be because children get sick more often and attract germs like magnets. One study reviewed an eye center's record and found the most common cause of preseptal cellulitis were tear duct infections and sinus infections, followed by recent trauma or surgery. Unlike a sty, which look like a localized bump near the edge of your eyelid, with preseptal cellulitis, your entire eyelid may be swollen, red, warm, and painful to the touch. Preseptal cellulitis is not pleasant, but a course of oral antibiotics can usually take care of it. In severe cases, you may be hospitalized, but that's rare. Frequent warm compresses can also help you get better faster. Going back to this ice cream cone, if an infection goes beyond the defense of the orbital septum, now we have post-septum cellulitis, also known as orbital cellulitis. This can be vision-threatening and even life-threatening. Orbital cellulitis is also more common in children. In most cases, the infection spreads into the orbital cavity from the sinus next to the eyes. Infections can also spread from our eyelid, our teeth and gum, middle ear, and bloodstream. Occasionally, preseptal cellulitis can progress to orbital cellulitis, but sinus infections are by far the most common cause. Like preseptal cellulitis, you are gonna get a red, swollen, warm, and painful eyelid. But if you also have pain with eye movement, limited eye movement, decreased vision, double vision, or if your eye looks like it's protruding out, you need to go to a doctor fast. These symptoms can be a sign that the muscles and fat around your eyeballs are now infected and swollen, pushing your eyeball forward and causing pain and headache when you move your eyes. Orbital cellulitis can progress fast. If you or your child have orbital cellulitis, you will need to go to the hospital to get blood work, CT scans, and intravenous antibiotics. Sometimes, a severe preseptal cellulitis may look like an orbital cellulitis, and if your doctor have trouble differentiating the two, they may err on the safe side and treat it as if it is an orbital cellulitis. The bottom line, if you have a swollen eyelid that's not going away, go see your eye doctor.